Every morning when I get out of the shower and look at myself in the mirror, I feel like a freak. And all I want to do is feel like a woman. I'm not having a boob job. I'm just doing it to be normal. Just have them be the same size. That's it. My name is Laurel Kellum. I live in Anaheim, California. I'm a 22-year-old single mother. Brista means everything to me. I wish my daughter would have come with an instruction book. It's fun. It's definitely the most rewarding thing I've ever done in my life, and you know, I look at her every day and thank God. When I was about 11 and I started developing, my right breast never completely developed to be the same size as my left. Being an 11-year-old, you don't know what's going on, and I just figured it would fix itself. You know, maybe that's just how Mother Nature works. Dancing was the most important part of me growing up. I did it from as soon as I could walk. It seemed like for years I had perfect costumes. I could hide it all the time, never ran into a problem until one year we had this beautiful blue dress, but it had this open back. There was no way I could wear a bra with it, no way. And I didn't have time to go downstairs and change. I had to change right after another number. I had one number to get changed on the side of the stage and get back out there. So everybody was watching me change, and a lot of my classmates saw it. And at that point, their eyes bugged out of their head and were like, what's wrong with her? Oh my gosh, you see him whispering and pointing, and I just stood there. And I was so embarrassed.
When Laura was growing up, you know, I could see a difference, and I remember she was about to go out to movies, and I took her upstairs and put her in front of the mirror, and I go, look, you know, maybe I don't think you should wear that top. And that was like the first we talked about it. And over the years, I just thought they'd kind of evened themselves out and had, you know, caught up with each other or something. I didn't realize she was covering it up so well.
I'm a 36A on the right and a 36C on the left. And in order to give the appearance that everything's natural, I've had to use padding in my bra for the past 9 years. And I guess I hid it so well that everyone thought nature just fixed itself and the problem went away. And I guess that's why my parents didn't know in the end. In July, when my dad got married, my stepmother and I went out dress shopping. And she's looking at all these cute strapless things, and I'm like, how am I gonna explain to these women that I can't do that? So finally I told Nora what was wrong. And you know, she broke down in tears and I broke down in tears. There we are crying in the middle of Robinson's May. And that was the first time I'd ever told anybody.
I'd known Laurel for almost 4 years and had no clue, had no knowledge. She carried herself so strongly, you know?
She actually told my dad without me knowing. And I was actually quite upset, you know? He's my dad, how could I tell a guy this? And when I found out she had told my dad, I was pissed. But my dad from that point on has been wonderful.
Okay, who needs another Dodger dog? How we doing on cheeseburgers over there? We okay? All right, we'll put a couple more on.
I was surprised to hear that the problem still existed. I had heard about it several years ago.
Doggy! I should have let my parents know what was going on, but I was embarrassed. I was humiliated. I didn't know what to say. How do I tell somebody that? I thought maybe it would fix itself eventually, but it's just getting worse.
Okay, this is the last of them.
I wish I would have told him sooner. But now he has discussed things with me that I never thought a girl could say to her dad. If I can share this with him, I can share anything with him. Jaime has a way of walking into the room and just making me feel better. And I haven't ever felt that way with anybody. He treats me like a princess, and he's absolutely wonderful with my daughter, Briston.
When Laurel told me about her problem with her breast, it was like, I didn't know what to do. Then she told me what it was, but, I didn't really think it was a big deal. But then, explaining to me all this stuff she had to go through, and it was like pretty sad.
Good girl. Just thinking about having this procedure finally done, it's given me confidence that I haven't ever had. I never thought I would ever have the opportunity to get this fixed. And I just can't believe it's like here, it's time, we're gonna do this, and I'm gonna be able to be a normal person. I can't even describe how excited I am. In the beginning, my mother didn't quite understand why it was such a big deal to me. She just didn't understand how drastic it was. And she couldn't relate. No woman on this planet can relate. You just are lucky enough to have gone through life with two beautiful, perfect breasts. Since I decided to go forward with it, she's been very involved and very supportive, had lots of questions, wanted to meet the doctor, wanted to be there for everything. And she'll be the one taking care of me afterwards.
Laurel, come back.
I've been researching it now actively only for about 6 months, but I did meet with about 13 different doctors, ranging from just your normal plastic surgeon to people specializing in the field. I found Dr. Corbin on the internet. I went and met with him and saw hundreds, if not thousands, of before and after photos of what he had done.
Let me ask you, first of all, some quick questions, and then we'll get to the reason why you're here. I think that patients ought to see more than one physician because they'll hear more than one story about what's in their best interest. I think also it gives the patient an opportunity to develop a rapport with the physician and with the office staff. When your breast started to develop, one side is bigger than the other? Of the two breasts, I imagine one is now drooping more than the other.
Correct.
Okay. Well, obviously, this is a complicated problem, but there are, some solutions. One can make the smaller breast larger using an implant, and then one can reshape the larger breast to get it more the shape of the breast that we've just enlarged. Obviously, that means operating on both breasts.
The one breast that's being lifted, do you actually take skin away from that?
Yes, skin is removed and the actual breast is reshaped. There is only an incision around the nipple-areolar complex and then one going down. And the final result gives you a shape that would be very similar to the implant that you're going to be placed on the other side. So the breast should look very similar. What stitches you will have will actually be very minimal to be removed, if there are any. Most of the suturing that I do is buried, or in other words, the knots are underneath the surface. There is no actual stitching on the surface, and the reason for that is, again, to minimize scarring.
Okay. There's going to be a significant physical difference, but not that anybody's going to be able to tell. Only me, only the few people that in my life I've let in and let know what's going on. It's all going to be emotional and personal and give me confidence in myself, build up my self-esteem, and give me a reason to feel good.
Okay, so you want to just stand up real quickly for me 1 second. And let me just make some quick measurements. I'm just measuring the distance. So on this side, on the smaller side, you're 19 centimeters from the sternal notch to the nipple. Measuring on the left side, and that's 25 centimeters, so there's a 6 centimeter difference. And this is actually where your nipple really should be.
After talking with Dr. Corbin today, I feel much more comfortable going into the operating room. As before today, I wasn't quite sure how they would actually place the implant and how it would affect me further on down the road.
I'm, incredibly excited for Laurel because I can't even imagine what effect it's been on her and lived with it. And she's right, she's hit it. When he did that exam, that's the first time I've seen her since she was probably 10. So I didn't know what she was dealing with.
I've lived with it for like 11 years.
So I'm very happy that, she has this opportunity and that she's pursued it, and, it's gonna like really happen.
So many people just think like, oh, she's getting a boob job and that's it. All of a sudden you look incredible. I had no idea how much pain and recovery time is involved with this. And I'm not gonna be able to drive a car for a week, and I'm not gonna be able to play with my daughter for like 2 weeks. And, I'm just gonna have to adapt to things like that. This is good. We should have done this a long time ago. It's gonna be more like soreness, not like pain. I get a little scared when I think of exactly what they're gonna be doing to me. But I'm definitely more excited than I am scared.